Good morning, everyone, and welcome to Live with Mel.
This episode is brought to you by Yellow Cab Company of DC. If you're looking to avoid rideshare prices, then check out the Yellow Cab Company of DC when you are in the nation's capital.
As COVID-19 is spreading across the globe, as we're in a global pandemic, we are seeing that the COVID virus is mutating. We've seen many different variants come into play and affect the nation in different ways and affect the globe in different ways. Now, each variant has its own calling card, and it does affect the body differently. The way that it mutates affects how people respond to the virus. We are now seeing with the Omicron variant that this variant is highly contagious, more contagious than the other variants that we have seen. Now, because of the various mutations, different medication will work against the viruses in different ways. Now, we've seen throughout this whole ordeal that people have been trying different medications. There are some medications that have been approved by the FDA and have been effective in treating COVID and its various variants. Other medication have not been, but have become popular on the black market. But now we're seeing that drugs, that medication, that treatment was once effective is now not effective against the Omicron variant. There are a pair of monoclonal antibody treatments that were once effective against the Delta variant that was effective against the other variants that we had. But these two treatments from Lilly and Regeneron, we are seeing are not effective against the Omicron variant. And because they're not effective against the Omicron variant, we are seeing them essentially being pulled for treatment of COVID. Now, the FDA has come out and limited the use of the two monoclonal antibody treatments for the Omicron variant. So the treatment from Eli Lilly and the treatment from Regeneron will now not be used to treat patients who have the Omicron variant. Now, this pull from off of the market has come because in the United States, about 99% of COVID in the United States is coming from the Omicron variant. Now, while there are some Delta variants hanging around there, the majority of the population, about 99% of the population who have COVID does suffer from the Omicron variant. Now, the FDA did come out with this statement. The FDA said, because data shows these treatments are highly unlikely to be active against the Omicron variant, which is circulating at a very high frequency throughout the United States, these treatments are not authorized for use in any U.S. state, territory, or jurisdiction at this time. In the future, if patients in a certain geographic region are likely to be infected or exposed to a variant that is susceptible to these treatments, then the use of these treatments may be authorized in that area. Now, again, the two treatments are the Eli Lilly and the Regeneron. Now, these two treatments, like I said before, were used to treat the other variants. And when the Omicron variant started coming into the United States back at the end of November, these two treatments were used to treat Omicron, but they were seeing that these two treatments, which again, very popular treatments, were not effective against the variant. It was not effective against Omicron. Now, there are certain drugs that are effective against Omicron, and the FDA is encouraging doctors to use these treatments. The biggest one being the sotrovimab. Now, this treatment is highly effective against the Omicron variant. However, it is not in big supply. Supply is very limited. And with the amount of people who are in the hospital for Omicron, there's not enough to go around. But the FDA is very adamant about not using the two treatments by Eli Lilly and Regeneron because they're saying that it's not effective, that it's not going to do anything. Now, while most people are following the science, there are people who are upset about the treatments from Eli Lilly and Regeneron being pulled from the treatment plan for COVID patients. Now, it seems as though the majority of people who are upset about this are coming out of Florida. We know that DeSantis and the Florida Surgeon General are upset about this, and they made their comments known publicly to the news, to the people, to anyone who will listen. They think that the President Biden made a rash decision and that he should wait for more data to be pulled in order to make this decision. And they're essentially calling for Biden and the FDA to put these two treatments back into place. Now, while the politicians may not like the fact that it was pulled, Eli Lilly, one of the companies that makes the treatment, came out with this statement. A spokesperson for Eli Lilly told CBS 12 News that the company agreed with the federal government's decision to limit the use of the drug, saying evaluations confirm that their drug is not effective at treating the current predominant Omicron variant. Now, again, the drug companies came out itself, and many people were not used to hearing the pharmaceutical company come out and saying, hey, we agree with the FDA. You shouldn't use our treatment to treat Omicron because it's not effective. So this is not just coming from the FDA. This is not just coming from President Biden. And this is not just coming from other doctors or researchers. This is actually coming from the drug manufacturers itself. They are saying that the treatment that they made, that they provided, is effective against the other variants, but it's not effective against Omicron. Now, as we are watching this, the main question is, if the FDA, if President Biden, if data, and the drug manufacturers themselves are saying that it's not effective against Omicron, then why are politicians upset about the decision? It seems as though everyone is on the same page about the treatments from Eli Lilly and from Regeneron not working against Omicron, but there are politicians, specifically in Florida, who are upset about the decision to pull these treatments from treating people with COVID. Let's go to the comment section very quickly. Wade says, COVID tests, specifically rapid tests, don't prove which variant you have. So how is anyone determining the amount of percentage? So essentially with the rapid treatment, when you go in, they do the rapid treatment, they let you know. However, if you're admitted into the hospital, they do more tests. It's not just the rapid test. So again, someone who has COVID, who takes the rapid test, who is able to stay home and just quarantine, they still have it, right? So they still send out to see which variant it has. But if you are in the hospital, if you're requiring a ventilator, if you're in a position where you need to be admitted, the tests that they run are a little bit different than just a quick rapid test and you're out. So they can, and the thing is, it does help determine what type of treatment that you have. Wade also says, the ones in Congress are mad. I bet you have shares in those companies. Oh, I'm about to get to that in a second. But first, let's discuss the other things surrounding this. Now, again, while the drug companies agree with the FDA, DeSantis and the Florida Surgeon General are upset. Now, Dr. Jofis Ladapo, again, that's the Surgeon General, came out and said this. We are laser focused on data. If the pandemic has taught us anything, is the importance of looking at the data and not necessarily listening and following what other people or people in the media label experts say. I'm saying that Florida is going to make decisions about how we treat patients, how we manage patients, how we inform patients. How we inform health policy in Florida is based on data. That's what I'm saying. For this particular case, clinical data is what we're looking for. Now, again, they have the data coming out. They released the data, the FDA released the data to the CDC, and even the drug manufacturer, who stands to make money off people using the treatment, is saying that the treatment does not work. So the question is, what is going on down in Florida? Why does the Florida Surgeon General and the Governor DeSantis, why are they upset about the FDA reducing the usage of these treatments? And again, I'm going to keep saying it. The drug manufacturers who make these treatments are saying it's not effective. The FDA, the data, the scientists, the Biden administration, they're all saying it. And it looks as though the only people who are upset about this are Florida politicians. And let's go to the comments. Joanna says, well, maybe they bought stocks. That's why they're upset. Now, they didn't specifically buy stocks. And we're going to get into that in a second. But so because these treatments were now deemed non-effective, the state of Florida announced Monday that it will close all its state-run monoclonal antibody treatment sites because, again, it's not working. It's not being helpful. Florida Governor DeSantis blasted the decision. He is upset about the decision, and he calls it reckless, abrupt, and an indefensible edit. Now, I'm going to read these quotes from DeSantis. Now, DeSantis says, he's demanding that the Biden administration reverse its sudden and reckless decision to revoke emergency use of Regeneron and Eli Lilly monoclonal antibody treatments. And again, this is coming from the governor of Florida, DeSantis. Without a shred of clinical data to support this action, Biden has forced training medical professionals to choose between treating their patients or breaking the law. This indefensible edict takes treatment out of our hands of medical professionals and will cost some Americans their life. The real-world implications of Biden's medical authoritarians is, and again, that's what DeSantis said. Now, DeSantis is very upset about this, but this is where it gets interesting. Now, while it's not being reported at the moment, back in August, there were some questions coming around why DeSantis was pushing Regeneron. Again, this is back in August of 2021. As of August 2021, DeSantis began promoting and pushing Regeneron. Now, if you remember back when President Trump had COVID, this was one of the drugs that was given to President Trump in order to treat him when he was sick with COVID-19. Now, after that happened, several months later in August, DeSantis basically went on a press tour and started promoting Regeneron. He started telling doctors, telling the media, telling everyone that this was the drug that was going to help Florida. He became very adamant about it and pushing it. Now, as people started to dig into his financial disclosures, they saw that he did not invest in Regeneron. However, there is a tie. While it's not a direct tie, there is a tie. One of his biggest donors, one of his biggest supporters did invest in Regeneron. Now, for his political campaigns, he needs money. He needs that PAC money. And one of his biggest supporters and biggest donors invested heavily in Regeneron. Now, Citadel, it's a Chicago-based hedge fund, has about 15.9 million shares of Regeneron, and that was back in August. So back in August, Citadel, again, Chicago-based hedge fund, had $15.9 million of shares in Regeneron. Now, the CEO of Citadel, Ken Griffin, has donated $10.75 million to a political committee that supports DeSantis. So in 2018, he also donated $5.7 million and $5 million last April. So it seems as though DeSantis may not be following the science like he says he's following, but instead he may be following the money. Now, again, when you are in politics, when you're an elected official, you do have to disclose your financial information. If you're trading, if you're investing, that is all public information. And at the time, no one can find that direct tie from DeSantis to Regeneron. However, one of DeSantis' major donors, the donor that has donated $10.75 million to DeSantis, is a major donor in Regeneron. So essentially, that money that they're investing into Regeneron is coming back to DeSantis some way, somehow. And it's looking as though DeSantis, back in August of 2021, began really pushing the drug Regeneron because his major donor was the CEO of the hedge fund who had $15.9 million invested into the company. So when people ask the question, why are politicians in Florida, like Governor DeSantis, upset about no longer being one of the main treatments, it's because his major donor invested in Regeneron. His major donor stands to lose a lot of money if Regeneron is not used to COVID and Regeneron. Now, again, the FDA has decided to pull 2 drugs from Eli Lilly, Regeneron, for treatment because it's not effective. It's not effective at all against Omicron. Even the pharmaceutical companies came out, the pharmaceutical companies that make the drugs have come out and stated it's not effective against Omicron. They know that, they understand that, and it should not be used to treat the Omicron variant. And because of this, they agree with the FDA's decision to not use their drugs anymore. The only people who seem to be upset about this are DeSantis and the Florida Surgeon General. These 2 individuals are quite upset, and they're saying that it was irresponsible if the data is not there. But it seems as though everyone agrees upon the data except for these 2 individuals and the people who support them. Now, again, while DeSantis does not support this, even though all the data is there, he does have ties indirectly to Regeneron. His major donor who has donated $10.75 million to his campaign, has a lot invested in Regeneron. The hedge fund that he manages, that he's the CEO of, has 15.9 million shares in Regeneron. And if Regeneron is no longer used to treat COVID, DeSantis' major donor stands to lose a lot of money. Now, again, DeSantis not directly tied to Regeneron, but where he gets his campaign funds, that is directly tied to Regeneron. And that could possibly be the reason why DeSantis is up in arms and is upset that Regeneron is no longer one of the major treatments to treat Omicron. And let's go to the comments. Joanna says, it's all about the money and not saving lives. And again, for this chapter of COVID, it looks as though everyone is just following the money. Everyone wants to do what's best for their pockets, including DeSantis. He wants to do what's best for his pockets, and that's why he's upset. Major donor is about to lose a lot of money because of this. And again, back in August, we know that he went around promoting Regeneron extensively for that very reason. It essentially padded his campaign pockets because his major donor invested heavily in it through his hedge fund. So guys, let me know what you think. Again, the FDA has pulled these two drugs. They said that it's not effective against Omicron. They also said that if a region does have another variant that becomes a dominant variant and they need to treat it, they will give emergency authorization use to that region. But at this time, because the drugs are no longer effective against Omicron, they're going to prescribe a new list of drugs that are effective against Omicron, which I think is fair and is best for the American people. However, DeSantis is upset. Several people in Florida are upset, but we do know that Florida has ties to Regeneron. And DeSantis' major donor is the CEO of a hedge fund, Citadel, a Chicago-based hedge fund, who has a lot of money invested in Regeneron. So guys, let me know what you think in the comment section below. I can't wait to hear what your thoughts are about this. And I will see you guys tomorrow. My name is Mel. I come live every single Monday through Wednesday to bring you guys current events and let you know what's happening across the globe and right here in this great nation. And make sure you tune in tonight for the Power Hour panel talk. We're going to be talking about this as well. So guys, have a great day, and I will see you tomorrow. Have a great one, everyone. And again, let me know what you think in the comment section below. If you agree with me, great. If you don't agree with me, that's great as well. Let me know in the comment section below. We can have that conversation. Have a great day, everybody.